Welcome to Berkeley, California, home to Charmalot 2025, the annual Charm Health User Conference. The good folks here at Charm Health invited us down to cover their conference, and full disclosure, they have paid for a little bit of our expenses. However, they have had no input into this video and have no idea what I'm about to say. This year's event brought together clinicians and administrators from a wide variety of practices, along with CharmHealth's partners, and they all came together to hear about the company's latest innovations, and let me tell you, there were plenty. From AI-powered documentation tools to tighter integrations with wearables and even improvements to the way that billing is done, CharmHealth had a slew of updates. And there were three themes that stood out to me: community, research, and openness. First, there was the announcement of CharmHealthSquare. You can think of it as a HIPAA-compliant community hub for physicians that's actually backed by CharmHealth's collaboration with Slack. Now, initially, I thought this was just going to be a physician's community hub or a forum, like a social media platform for physicians, but it's actually more than that.
So CharmHealthSquare speaks to our desire to build an ecosystem. So what happens is that often physicians who work in moderate to smaller practices or even larger practices sometimes don't have the venue to discuss their thoughts or update themselves or learn from each other the way someone at, say, a Kaiser or a Sutter would be able to do. And we want to bridge that gap. We wanted a platform where these physicians could all freely discuss. It's HIPAA compliant, so they don't have to worry about that. So they can talk to each other, discuss referrals, get advice and ideas from each other, and they can also be part of an ecosystem, and they can communicate and learn from each other. And we will be supporting this continually by having expert webinars, expert CME courses, and so on. So they can keep themselves up to date and benefit from each other's companionship at the ecosystem. The other thing is that as we move on forward, we are planning to integrate it more and more with the EHR. So they will be able to share information from the EHR through the system. And I'm so glad that Slack is partnering with us. So they are one of the best tools out there for collaboration. So here, by being part of our ecosystem, they're bringing that to us so that our community can feel like one.
So the idea here is to give smaller and mid-sized practices, which are CharmHealth's typical clients, the same collaborative advantages that larger health systems take for granted. Another major announcement here at Charmalot 2025 was CharmLabs. And this is where CharmHealth plans to tackle deep tech challenges as well as fundamental research.
We are at that position now where we have to invest more into deeper research and technologies. I'm a PhD, so I have this penchant to do research all the time. So we have started building out our team, and we've started looking at what areas we could actually develop fundamental research in the area of health tech and things that make sense to our community of providers. So as I was talking at my presentation, we are looking at the overarching goal of a real-world platform, similar to what the NIH is thinking about. So we are able now to build a platform where we can bring in research data or device data or data from claims or any of the business data back into one platform, and then invest time and effort into developing really deep research protocols so we can enable higher level of reasoning and support to physicians and researchers who use that platform. So my goal is that eventually you will be able to bring in your own data, medical data, and then there is EHR data, and you can superimpose the two, and you can ask questions. For example, you can ask questions such as, how many subgroups are there among my patients? Determine what drugs worked for this population. Can you find me another patient who looks just like this? What happened to that other patient? Predict some outcomes. So these and other deeper insights, which today are not available at the fingertips of physicians, are possible if we invest some effort into looking at algorithms and how we can mine the data to provide these higher level insights.
Now, another big theme from this year's event was openness. Through a growing set of APIs, the company is working to ensure its platform plays well with the rest of the healthcare ecosystem. That openness is what won over national scale groups like Sound Physicians, who have unique needs for their EHR.
The piece that stood out for us, again, was the telemedicine component, so making sure that our doctors can do video, phone, and chat. But what is unique about Charm is there are other groups and practices who use the technology for in-person visits. So what I saw with the application was that it really had almost like within its frame all of the pieces that you need for telemedicine, but we knew that there were some components that we would need to tweak just for that telemedicine or remote encounter. They are slightly different. And what was really great about Charm is they have, as a part of the enterprise solution, the ability to leverage APIs and to work with their development team to make sure that you can customize. So I knew going in that we needed customization, and that's what really drew me to them, just outside of the software that they do have existing for the telemedicine and the EHR itself.
When we talked last year, we didn't have this much of enhanced APIs. We built a lot of APIs based on their requirements, and then also worked very closely with Dria and team and their engineers. And then we also gave them a very good aggressive timeline as well as a contract. So I think we made a huge commitment, and we thought this is a great opportunity for break into this. And then because of that, a lot of good things have happened to us in the last 1 year.
And while the company's APIs are important, support and partnership matter just as much to large practices like Sound Physicians. Sound Physicians operates nationally, and the support from Charm Health is key to their continued growth and success.
So as part of the enterprise solution that we subscribe to, we have a dedicated partnership manager. His name is Kieran, so he works very closely with me. We actually currently meet every 2 weeks, which is great just to touch base. But I have a dedicated representative who's there to help me think through all elements, whether it's troubleshooting, thinking about using the different APIs and working on the platform from a dev perspective. So he's really there for us when we need it. We don't always pull on our partnership manager. They also have email where you can write to their support team and they can really respond. I haven't seen a response take longer than 24 hours, and I've been with the Charm platform for over a year, so they're very quick to answer. Separate from the support email, they actually have an API support email where you can get straight to the developers, and that's really utilized by my developers. So it's really a way for two development teams to be talking to each other in real time.
AI was another big theme here at Charmalot 2025. There was a headlining keynote from Dr. Justin Norden from Stanford Medicine. His take is that we should no longer consider AI as a novelty. It's a tool, and we better figure out how to use it. Why he says that is because Norden looks at AI and sees that the benefits of AI are asymmetric right now. He looks at it and sees that individuals are the ones who benefit most from using AI because of the productivity gains, but organizations aren't necessarily reaping the full benefit. He's pointing to the challenge that smart organizations are working very quickly to figure out how to leverage AI. And his hope is that healthcare providers and health tech companies will rise to that challenge to figure out how AI can benefit them. I certainly hope they figure it out. exhibit hall. Let's go check it.
Hi, I'm Colleen. I'm here with Charta Health at the Charmalot conference, and we've been having a lot of conversations with providers at our table about how there are a lot of manual inefficiencies happening right now on the back end in the RCM, and we integrate with Charm Health to make that easier. So people are really concerned right now about the operational inefficiencies around denials and compliance, as well as any potential revenue that's being left on the table. So making sure all of those CPT codes are matched appropriately, making sure there are no documentation gaps or clinical quality analyses that are being missed.
Hi, this is Jeff from Claim USA, and I want to tell you what we do. We specialize in medical claims factoring, which means doctors, practitioners, practices do not have to wait 3, 6, 9 weeks to get paid from insurance companies. We will pay them in 24 hours from the time they see their patient, and we will wait to get paid.
Hi, this is Olga Muller with IMRE and Kepler team. At Kepler, we help digital health innovators do many different things, from designing their products and fine-tuning their ideas and going through that market validation to creating those prototypes or MVPs. And then with IMRE, we're helping them expedite their pathway to adoption with healthcare systems, because what IMRE is, it is a pre-integrated provider portal that makes that path from point solution to extension of provider workflow very simple and painless.
I'm Justin with Vital, and so far here at Charmalot, we've been having a lot of conversations around the e-prescribing process and how we make that simpler for practices by creating workflow efficiencies so they reduce their time required to place these medications, and also how we make things simpler on their patients by providing real-time visibility into the fulfillment status of their order, tracking information, dosing instructions. So it's all about just improving operations and improving patient experience when it comes to e-prescribing compounded medications.
Hi, I'm Pujata. I'm from Mavix AI. So we've been having a lot of people come over to our booth, and they are really excited to know about all cool features of Mavix, especially things like customization. We do custom templates for all providers based on how their clinical note should look like. So we match it to their exact clinical note style. Another thing they are so excited about would be that Mavix generates ICD-10 CM codes. We also generate ENM codes along with a rationale, the AI summarizer. So Mavix pulls everything from Charm, and then it creates a patient recap, pulls all details about the lab reports and imaging and previous discharge summaries, and then it is well informed about the patient previous conversations with the provider. So these are a few things that the attendees, especially the health providers who visited our booth, were really, really excited about.
Here at Charmalot 2025, one thing was definitely clear. Charm Health isn't standing still. From community building through CharmHealthSquare, to deep tech investments via CharmLabs, to enterprise openness through APIs, the company is broadening both its ambitions and its customer base. And the growth is showing. Since last year, when I last attended this event, Charm Health has signed on larger and larger practices, proving that their platform is maturing. The challenge ahead for Charm Health will be balancing that enterprise momentum while continuing to serve the smaller clinics and independent providers who help build its foundation. I want to thank Charm Health for their hospitality, and I really enjoyed being here in Berkeley, California. I hope to be back next year to see how the company will strike that right balance and to hear about all the new features they're adding over the next year. I'm Colin Hung. Thanks for watching, and I'll catch you on the next video.